Welcome to In Focus with Ejaz Haider. Tonight we begin with a discussion of U.S. Pakistan relations. We had discussed how relations might or could pan out in 2021 when U.S. President Joe Biden had assumed office. The thrust of that discussion was whether Biden would begin the conversation from 2016 or assess that the intervening years had changed much. Since then, some early indications are that the Biden administration might still be relying on path dependence. Last week, the State Department spokesperson referred to occupied and illegally annexed Kashmir as Union territory. And he said, we welcome steps to return the Union territory of Jammu and Kashmir to full economic and political normalcy, consistent with India's democratic values. Last month, while welcoming the resumption of high-speed internet in the occupied valley, a State Department tweet referred to the disputed territory as India's Jammu and Kashmir. Zahid Hafiz, spokesperson at Pakistan's Ministry of Foreign Affairs, responded by saying that the tweet was inconsistent with the disputed status of the region. On Afghanistan, cooperation seems to be closer. Pakistan is in contact with the U.S. and also other regional players in helping the U.S. with its policy review. U.S.-China relations are another area where the two sides have obvious differences. The issue gets further complicated because of U.S.-India strategic partnership. The essential question, however, is this. Can relations go beyond the immediate and the narrow and become less prone to ebbs and flows? To discuss this further, I'm joined by Ambassador Akram, Pakistan's permanent representative at the United Nations, Ambassador Najamuddin Sheikh, former Foreign Secretary, and Toby Dalton, co-director and the senior fellow of the Nuclear Policy Program at the Carnegie Endowment in Washington, D.C. Let me quickly begin with Toby Dalton here. Toby, is this conversation going to start from 2016? Is there path dependence, as I said in my opening, or do you see any subtle changes?
It's pretty clear that there is an element of continuity in U.S. policy. You even see that in the State Department spokesperson's remarks, that the policy that the U.S. is applying towards the region is going to be consistent with elements, I think, of the Trump administration's policy. And yet you can also see that there's some changes in the interim. I think I'm sure we'll get into it further, but the use of the word Union territory, for instance, that terminology, that shows some understanding that things have changed in the region. I also think it's important to note, you didn't specifically mention it in the intro, but there's also now an interim national security strategy that's been released by the United States from the White House. The word India appears once. The word Pakistan does not appear at all. China appears 15 times. Russia just 5. And so I think you see that there is now a very significant shift in the attention of the U.S. towards East Asia and away from more traditional focuses on Europe or the Middle East or indeed on South Asia.
That you mentioned, I should actually have mentioned that interim national security strategy in my opening. But thank you, Toby, for these opening remarks. Let me take this to Ambassador Munir Akram here. Ambassador Akram, as Toby Dalton said, that the reference to Union territory shows that the U.S. has an understanding that things have changed in this region. Now, that is something which obviously is inconsistent with how we look at things. So since you're there at the, shall I say, at the trenches, the front lines of this, how do you look at this?
I think we should also note that the State Department also clarified that there is no change in the U.S. position. And the terminology used could have been a kind of factual representation of what is received from Indian sources describing it as Union territory. Hope they will correct the mistake, because if the U.S. position has not changed, as they say, the U.S. position has been to recognize Kashmir as disputed territory. And that is certainly Pakistan's position and Pakistan's hope that the U.S. will not unilaterally change its position and align it with a position which is illegal, which India has propagated. But on the larger issue, of course, there are now areas of convergence with the U.S., especially on Afghanistan, and there are areas of divergence, which is the U.S.-India relationship. That relationship, one will have to see how that evolves. There is a strategic partnership aspect as well against China, to counter China. But is India willing to enter into a full alliance with the U.S. and confront China? The disengagement in Ladakh has some counterindications. And Pakistan's cooperation with the U.S. on Afghanistan is another aspect where the balance of the relationship may become more equitable. And over that, there is a question of how the U.S. will square its advocacy of democracy and human rights with the Modi government's record of authoritarian rule and extreme violations of human rights, which have been reported and attested and are admitted by everybody. So I think it's a transitional phase. I don't think that the US or Pakistan have found the exact path on which they will traverse. It is a fluid situation, and one will have to see how this evolves. The big question will be how US-China relations evolve. Will it be an out-and-out confrontation, or will it be a combination, as President Biden has said, Secretary Blinken has said, of a competition, a cooperation, as well as adversarial relations in some aspects. So the Pakistan-U.S. relationship will depend quite a lot on U.S.-China relations and U.S.-India relations, and one has to see how those relationships evolve.
Right. Now, I'm happy to talk about democracy. Ambassador Sheikh, the State Department spokesperson that I quoted in my opening talked about, the hope that the situation will go back to, a point which is not inconsistent with India's democratic credentials. Now, the world keeps talking about India's democratic credentials, but the fact is there are a number of organizations, including the recent Freedom House report, have actually downgraded, the Freedom House report has downgraded the quality of democracy in India. So give me a sense of how this is going to square with this idea of India as a democracy, secular, inclusive, because facts on the ground are completely different.
In fact, I think that there is a basic continuity in U.S. policy towards South Asia, and that policy is very strongly biased towards developing the relationship with India, if necessary, to recognize that India as the preeminent power and, frankly, even the hegemonic power in South Asia. Because you go back to the Bush era, to 2005, to the Indo-US nuclear agreement. You go back to the fact that Robin Raphael, who is going to be, I think, an important player in determining Biden administration's policies towards South Asia, talked about the fact that much water has flown down the Indus since we talked about the United Nations resolutions and a solution in accord with the UN Security Council resolutions. You talk about the fact that Ambassador Brownback asked that India be classified as a country of particular concern with regard to religious freedom, and you had the State Department refuse to endorse that particular point. These are all indicative of the fact that, in a sense, what the courting of India, which started earlier, which reached a particular climax during the Clinton visit, and perhaps in 1999 when the Kargil incident happened, it just served to cement the fact that in terms of India's own perception of its needs, the United States is going to play an important role. Now, I know that we talk about Foreign Minister Jaishankar and his other partners seeking to prevent a further deterioration in China-India relations. But the fact is that there is a growing feeling that perhaps that is not going to work, and I think Chinese Chancellor Wang Yi's statement that there are some dissident notes being struck with regard to the withdrawal and disengagement on the line of actual control point towards the fact that perhaps it's not going to go as smoothly and as quickly towards a restoration or disengagement of the nature that both countries said they are anxious to have. This much having been said, let me also say that China is anxious that the relations with India improve, and that relations between India and Pakistan should also improve, because that will then not be a point of contention between India and China. So there are efforts being made in that direction. There's going to be an enormous amount of diplomacy involved in this, but my feeling is that for many in the United States, the competition and cooperation, adversarial and cooperative, are terms that will continue to be used, but the direction is one of serious competition. And I think that in that context, you also have to take account of what has been created as the Quad. The Quad is, frankly, to my mind, largely toothless, but because it has no economic component at all. It's just Australia, Japan, Korea, and India getting together, doing naval exercises. But beyond that, there is no economic component to this. And I think that that is a factor that you have to take account of also, particularly the fact that in East Asia, the RCEP, the Regional Cooperation for Economic Partnership, is one from which India has excluded itself. Its relations with East Asia are therefore going to be somewhat less less valuable than it would otherwise be.
Right. I'm happy you talked about the Regional Comprehensive Economic Partnership, because two of the Quad members, Japan and Australia, are also part of that trade bloc, which incidentally is the largest trade bloc, with about 30% of global GDP and about 30% of the population. Toby Dalton, so here's the thing. Let's try and pass this. So if we accept, as you also mentioned, that China is the main, is going to be the main foreign policy challenge, and if we also accept that the United States is going to partner India, both for reasons of India's market, as well as to have India in the camp to counter China, then I believe that it will be logical to surmise that realpolitik is going to trump no pun intended, going to trump the humanitarian concerns and what's happening in occupied and illegally in ex-Kashmir. Is that something, and I say this because you'll recall that President Biden talked about having a big conference of democracies. And so it'll be difficult to see how he's going to square if he invites Narendra Modi to that conference. How is that will be squared with what's happening on the ground in India? But as I said, realpolitik is likely to trump humanitarian concerns. So give me your sense of how you look at that.
It's a really interesting question. And now just, barely a couple of months into the Biden administration, I don't think we have a good sense how those tensions will be resolved in U.S. policy. And maybe we'll get some better indications as this democracy meeting shapes up. Obviously, the early engagements with China will be critical, the extent to which the U.S. is willing to be much more vocal and open, for instance, about the abuses carried out by the Chinese government in Xinjiang. And then as it relates to India, how vocal the U.S. would be willing to be about what's been happening with the curtailment of freedoms in Kashmir. So, I think this is a problem in any government, but because of the way the Biden administration has both set up the need to take a more realpolitik approach to some global competition with China, in which it currently sees a role for India as a global strategic partner, I think was the words that were used by the State Department spokesman, and the extent to which then that makes it much more difficult to pursue more values-oriented foreign policy. We'll see how that shapes up. I do think that in that regard, there's an interesting debate in Washington about how far to go in seeing the competition with China in ideological terms. And the pendulum swing on pushing for a much more competitive approach to China across every sector has really changed in the last few years. And I think in that regard, President Biden has a hard problem to even advance this more sort of hybrid model of competitive relationship with carve-outs for cooperation on areas of shared interest. And even that one, I think you're going to see a lot of pushback from Congress, a lot of pushback from other sectors. And that one, I think, is perhaps even harder than the tension to resolve the values versus realpolitik part of that relationship.
Right. Let me ask you, assailing this from a different perspective. So USIP had this senior study group report with reference to US-China relations. And, that report has a sizable sort of portion that was dedicated to, with reference to US-China relations, to Pakistan. Similarly, Professor Wali Nasr and Shumaila Chaudhry wrote this op-ed with reference to US-Pakistan relations. Then former US President to Pakistan, Richard Olson, penned something for USIP talking about how one could get it out of the transactional mode into something more sort of, solid. Is that something that you think the Biden administration would look at seriously, and in addition to Afghanistan, and in addition to, or shall I say, despite its strategic approach to India, that it would want to find those areas which could perhaps put this relationship on a more sort of stable, firm ground?
Believe that that's possible. The articles that you referred to, I think, show that there is some struggle within the U.S. analytic community about how to build such a relationship and on what basis with Pakistan. And it's unclear to me at this point how much oxygen there will be for those ideas within the Biden administration. As you can see, the weight of many other issues on the administration at this point, not least the pandemic and the U.S. economy, I think makes it really difficult to walk and chew gum and juggle and carry out the many other acts that are expected of the U.S. government. And so I'm cautiously optimistic that there will be at some point an effort to figure out a new basis for U.S.-Pakistan relations so that we don't get these wild variations, the high amplitude, for instance, in the sine wave, where you have moments of overconfidence in a strategic partnership and then extreme lows where it seems like the two governments are at odds on every issue. It would be nice to find something that's a little bit closer to the middle. And I think there are shared interests, shared ideas about ways to do that. Obviously, for instance, the focus in the U.S. administration on climate change provides one basis on which there could be a lot more cooperation and dialogue and economic relationship, for instance. But you do have these other lingering, festering issues. Obviously, there's a lot of distrust in Pakistan about the U.S. move to build the global strategic partnership with India, and also a lot of concern about U.S. intentions with respect to Afghanistan, and those sorts of issues. I think it's on the one hand, there is a recognition in the Biden administration, I think, that the issues have evolved in the 4 years that they've been out of office. On the other hand, there's also a lot of sort of bad memory about the way in which things transpired in the last few years of the Obama administration in U.S. Pakistan relations. And I think there was a lot of fatigue in trying, and having tried to build something more aspirational in the relationship with Pakistan and then seeing that basically crash and burn. I think there's a lot of caution now about too much overreach, if you will.
Right. Thank you so much. That was Toby Dalton speaking with me. Let me go back to Ambassador Akram here. Ambassador Akram, so it seems that there are multiple strands or, if you will, multiple balls that the Biden administration will have to juggle. But on a more sort of legal note, tell us how it works if there is a dispute on the agenda of the United Nations Security Council. The member countries, are they compelled to refer to it in terms of what that status is, or they can have their independent foreign policy approaches to that particular thing? I refer to it with reference to the State Department spokesperson reference to occupied and illegally Kashmir as Union territory.
No one can prevent a sovereign country from taking a position on a dispute, whether it is on the UN agenda or not, in ways that reflect its own national position. So the United States could very well take a different position than what is the recognized United Nations position. The legality, however, flows from the Security Council resolutions and the agreements on Jammu and Kashmir. So international legality requires to recognize it as disputed territory, which all the United Nations maps, for example, all of them recognize and depict Jammu and Kashmir as disputed territory and are shown as such. But of course, it is up to every government to refer to it in whatever way they wish to reflect their own national positions. The U.S. in the past has recognized Jammu and Kashmir as disputed territory. It says it has not changed its position. If it has not changed its position, then it has to recognize it, that the old position was that it recognized Jammu and Kashmir as disputed territory. But let me come back to a point that both Mr. Sheikh made and Toby made on the whole issue of U.S.-Pakistan relations and what are the basis for a new relationship. I would say that I think from Pakistan's point of view, you've got to see that our reliance is principally on China for security, for economic support, on all issues. Even in relations with India, we have a deep relationship, a deep reliance, and extensive cooperation with China. And that will not change, regardless of the relationship that we devise with the United States. I think that is a pillar of Pakistan foreign policy, which will not change. So we have to find, the US has to find space for the Pakistan-US relationship within the context of its own overall policy on South Asia and the Indo-Pacific. Pakistan has to find that space within the context of its relationship with China. And that is a very limited space. And we are still groping to find that space. Afghanistan cooperation is one point. Perhaps economic cooperation is another point. But it is as Toby has mentioned, it is difficult given the history and the strategic context of the world today. It will be a difficult exercise to find areas of cooperation that will override the strategic compulsions of both countries.
Right. Thank you so much. That was Ambassador Munir Akram speaking with us. Before I wrap up, let me go back to Ambassador Sheikh here. Ambassador Sheikh, now here's the thing. Of course, there is a strategic partnership with China, but equally, officially, whether it's the National Security Advisor, Dr. Moeed Yusuf, whether it's the Foreign Minister, and also the Prime Minister, made it very clear that Pakistan does not want to be in any camp, and that anyone is most welcome to come and invest in Pakistan. That includes the United States. A number of occasions we've also talked about the move from geopolitics to geoeconomics and so on. So it seems to me that without prejudice to what Ambassador Akram was saying, that if we stick to that, and I'm not saying that it's going to be easy, because there are exogenous factors that are likely to force states' hands into taking sides, but the fact is that if we try and stay this course, then perhaps we can find areas of convergence with the United States without necessarily jeopardizing our relationship with China.
I don't want to go back into history, but I recall that just before 2001, just before 9/11, Armitage said that, our relationship with Pakistan has been against things. Has been against the Soviet occupation, it's been against India. It's never been but for a relationship between Pakistan and America, for Pakistan and American people. Now, he said, this is what we have to try and build on. And that is why I'm saying that Pakistan and the United States must develop a relationship between the Pakistani and the American people. Now, let's also remember that even from that time, and I'm talking about 9/11, the question that arose and the question that arises even today when there is a reference to Pakistan in the statements by the State Department or by the Defense Department, by General Austin, there is a reference to the fact that there are terrorist organizations that have a base in Pakistan. This is what is also bothering us with regard to the FATF, and I think we are doing things to set this right. When we set this right, then the other things that you talked about, including the fact that we could be a very good opportunity for American and other investors, that can come about only if we are able to correct this particular aspect. Now, I hope that by June that will happen. If by June this happens, and the statements that we've made and the steps that we've taken seem to suggest that we will be off the grey list by June. And if that happens, that means that we've settled a number of problems. We've put one element of our economic house in order, and thereby created the conditions in which there can be investments.
But Ambassador Sheikh, let me here, because I've had the occasion of speaking with people in the previous government also, and in this government also, people who deal with this FATF, or call it FATF, if you will, and there is the common denominator is that FATF proceedings with reference to Pakistan are less technical and more political. It's a tool to keep Pakistan under pressure. Now, and I'm saying this comes from people who are actually dealing with this issue. Now, if that is correct, then I believe it will be very difficult for us to get out of this so-called gray list, because these countries, including the United States, Britain, France, Germany, and of course India, would like to keep Pakistan under pressure.
Let me put to you what the facts are on the ground. There's a New York Times correspondent in Delhi, a gentleman who has done a lot of work in Kashmir and whose last effort in this direction, which relied very largely on Indian sources, said that everything that is happening in Kashmir today, the resistance that is being put up to the Indian occupation, is by the Kashmiris themselves. That is, he said at one point, he said there were 8 people that could be thought of having crossed across the line of control, but otherwise this is an entirely indigenous movement. It is an entirely indigenous movement and therefore has to be treated as such rather than holding Pakistan responsible. That's not the issue. The issue is, what is the perception? The perception is that every statement, I'm sorry, I'm repeating this, but every statement that has emerged from the State Department or from American sources, we have our own compulsions, we have our own difficulties, but we must recognize that we are a nation of 220 million people, but we are unfortunately very dependent on the goodwill of the world, and not just China and
That's actually, Ambassador Sheikh, sorry, we've run out of time. We shall take a short break and return to discuss the spike in COVID-19 cases in Pakistan. Stay with us. Welcome back to In Focus. The number of COVID-19 cases has surged by around 50% ever since the National Command and Operations Center eased restrictions late last month. As many as 1,714 people contracted the virus. 38 lost their lives in a single day, while the number of active cases increased to 17,352 by 6th March. Meanwhile, Pakistan continues to lag behind other countries in the region in terms of vaccine procurement, supply, and actual vaccination. Reports suggested a sizable number of government employees have refused to be vaccinated. In the middle of all this, people have dropped all non-vaccine precautions, going around without masks, not maintaining social distance, etc., etc. Where does the situation stand, and what's the best course for us? To discuss this, I am joined by Dr. Shapa Mirza, Associate Professor in the Department of Biology at the Lahore University of Management Sciences. And we also hope to be joined by Dr. Samia Altaf, who's Professor of Practice in Public Health at LUMS. Dr. Mirza, there has been concern among the health experts that NCOC has eased the restrictions without ensuring that people actually practice the standard operating procedures, and also with reference to the issue of vaccines. So give me your sense of how you look at the situation.
So I think it's a lot deeper than just shutting your guard down. So while it's important to keep your guard up and keep your follow the SOPs, I think that there's another important issue that people are kind of skirting away from it, and that is constant evolution of virus. So virus is constantly in this process of evolving, and it's trying to make itself better and better at infecting people. And where people were spending a lot of time together and were not getting infected previously, the situation has kind of reversed now, that you don't need to spend a whole lot of time with an infected person and you get infected, which means that the virus had developed this ability to be easily transmissible. So that's one thing. And in these situations, yes, it's very, very important to keep your guard up, to follow the standard operating procedures. And unfortunately, even when the first wave came in Pakistan, people were not really too keen on following the standard operating procedure. Then the second wave came in and people got a little bit scared, but then still there was a great percentage of people who were still not wearing masks. But I think that the virus that caused infection in the first and the second wave was still not as adapted to the human host, and it was still taking a while to infect other people. So the transmissibility was relatively low. But now I think that the virus had adapted to the human host, especially to the people in Pakistan, particularly to this ethnic group, and it is transmitting itself very easily. The other thing could be that the virus that is coming from other places from the world, like for example the British strain that was highly pathogenic, which means that you don't need to spend a whole lot of time with this virus before you get infected. So people were getting infected after spending 2 to 3 hours with an infected person, which is normally not a lot of time to get infected. So one of my theories would be that the virus has gotten smarter. It had evolved to cause infection in a very short period of time, or at least get transmitted in a very short period of time. Secondly, yes, people are more careless, and because this infection has been around for almost a year and a half, people are losing respect for it. So initially, where there was a little bit of concern about it, people are now losing all of that concern. And given the fact that the vaccine is out there, people believe that at some point we will get vaccinated, or somebody else will get vaccinated and the herd immunity is going to protect me. So I think that there are multiple theories out there, and we need to, the first thing, the easiest thing that you can do is to keep your guard up, to follow all the standard operating procedures, and then leave the rest to the researchers. I think Pakistan need to invest a little bit more in the research in trying to understand this virus and trying to understand its mechanism of pathogenesis, so that we can develop better methods of prevention of this infection, because cure is actually not in sight at the moment. So we need to put all of our eggs in one basket, which is the basket of prevention.
Right. But I can assure you, Dr. Mirza, and this is an occupational hazard, so I have to keep an eye on these things. But people, and I'm not just talking about the semi-literate. I'm actually talking about those who are educated. Couldn't care less about the SOPs. They're getting together, weddings and birthday parties and the rest of it. No social distancing, nothing whatsoever. But as I said, I'm also joined by Dr. Samia Altaf, who's Professor of Practice in Public Health at LUMS. I'll come to Dr. Altaf in a second, but I want to go back to Dr. Mirza with reference to the evolution. Now, is this just the transmission part of it, where it's become more infectious, or is it also more virulent now?
I think it's both the infectious part and the virulent. So it is more virulent in the previous episodes, or in the previous wave, it was infecting more people, but there were fewer deaths. But in the second wave, there were lot more deaths than the previous episode. And in the third wave, you've already seen that there has been like about 50 to 60 mortalities within 24 hours. So it's not only getting more smart in transmitting itself from one person to another, it is also getting really smart in causing the infection. And the infection is more severe this time than it was in the previous 2 times.
Now, that's bad news. Dr. Altaf, you're talking about the fact that the NCOC relaxed, well, actually got rid of almost every restriction. And we've seen a surge now. Dr. Shapir Mirza is saying that both the transmission and the virulence have increased. People, as I said, are not following any SOPs, and unless they are enforced by the government, at least in urban spaces, there's no likelihood of people actually following them in terms of, being sensible and in terms of it being a norm. Give me your sense of where you think the situation is.
Thank you very much, Ijaz. I quite agree with, I came in at the end, so I caught Dr. Mirza's remark that, the prevention is basically the key to dealing with this. I quite agree with her. because I feel that, if we step back, this speaks to the issue of and the place of prevention systems, the place of prevention systems in our strategies. The context of dealing with these problems is that, of course, the first line and the responsibility rests with the health system. And you've been talking about this, that the government strategies are erratic, they are piecemeal, they are inconsistent. And the optics is also very strange, because yesterday also somebody said to me, and I also saw it when after the elections, the ministers actually were without their masks and they were hugging each other and slapping each other on the back and talking. So these kind of things are important, that people look at those things, and these policymakers are basically the role model. And so for us to change our behavior and our attitude at that higher level is the first step. The policymakers expect, and the ministers come and announce to the people that you should follow SOPs and wear masks and don't sit close to each other. Yet when they are seen doing something entirely different, it undermines their message. Nobody does it deliberately, I understand that, but that is exactly why we need to bring some science and some consistency and some expertise to develop these mitigation programs in a consistent fashion. The preventive health systems and preventive health methodologies have always been kind of a stepchild of the health system, because it uses a vocabulary that everybody understands, which is different from a vocabulary that surgeons or cardiologists use. So everybody thinks, well, I know what it is, but there is a distinct science and research that goes behind this, and I am very distressed to see that over this past year, that has not been brought to developing consistent mitigation strategies and developing consistent communication strategies to the people. And I quite agree, although I think that, the issue of the virus, kind of changing into one which is more severe infections and is much more virulent. There's some data also that contradicts that. So, research needs to be done on that. But whatever it is, the fact still remains that the context for dealing with this for the future has to be a public health and a preventive health system. And the science of public health and the science of preventive health need to be brought to it with people who are skilled and experienced in that. Without that, it will not happen, because, we just flounder from one crisis to the other, and we just kind of hope that, it'll get warm, or, it'll get sunny, and things will get better. So it's a very distressing situation, very, very distressing.
Right. Before I wrap up, Dr. Mirza, a word about vaccine. Now, there are two aspects of it, as I said in my opening. There's the issue of actually procuring the vaccine, the supply chain, and actually the other is getting people vaccinated. Now, even though we've been laggards, the fact is that the government employees have chosen, not everyone, but lots of them have chosen not to get vaccinated, even when the vaccine is available for them. Now, give me your sense of A, about the supply chain and the procurement, and secondly, about the attitude of staying away from the vaccine.
So, actually, you have asked a lot of questions here. First
I
of all,
understand. I know I'm burning you with little time and lots of questions, but let's give it a shot.
I think everybody, each one of us is asking the same question. First of all, the procurement and the supply chain. Even if we maintain which is highly unlikely to happen, that we maintain the supply chain and the procurement. But let's say by one mean or the other, we are able to maintain the supply chain and procurement, and we have procured enough vaccines for the, let's say, 80% or the 60% of the population. The changing people's attitude towards vaccination or immunization will be the key to delivering this vaccine. And I think we are already struggling with polio vaccine. We are already struggling with so many other vaccines. People are just not into immunization in Pakistan. Nobody takes flu shots. And, I'm probably one of those people who don't take flu shots. But flu shots is not going to cost us as many lives. Not taking flu shots is not going to cost us as many lives as not taking a COVID vaccine. So again, the problem with infectious diseases and their treatment, or any kind of disease and their treatment, is our human behavior, that we first have to admit that there is a problem. As it is, people are not taking COVID seriously. They don't think that it is a problem. And you're talking about government officials. Look at the healthcare workers. A lot of the healthcare workers are declining COVID vaccine.
Absolutely. I actually included them into that category, but you're absolutely right. I mean, these are people on the front lines of this. But let me take this to Dr. Altaf. Dr. Altaf, we've earlier talked about this on this program with reference to supply chain and the rest of it. But give me your sense of, there are lots of people who are saying, well, we don't know whether the Sputnik 5 is the right vaccine to take. So that there is that issue also. Then there's the Sinopharm thing, and some of the people who actually take COVID seriously and are taking preventive measures are saying, well, we still need to get some data before we decide which vaccine we want to choose. Now, that seems like a sensible approach. Is that something that you would agree with? Because there are categories of those who don't want to get vaccinated right now.
This whole issue goes back to trust. People will accept interventions in their lives and in their to get them healthy and free of disease if they have trust in the system. You and I have talked about this before, and of course, as Dr. Mirza had mentioned, that we are struggling with polio and we are struggling with other vaccines because people really don't have a trust in the system. Getting a vaccine into somebody's arm in Tandwala Yar or in Daska, involves a lot of steps along the way. And each step is very important. Each piece is very important in this chain based on trust of the system. So that trust is lacking. Number two, of course, the government strategy of communication and of consistent mitigation efforts and bringing in vaccine as a part of that mitigation effort in a structured fashion and in a consistent fashion and in a fashion which they give information about the vaccines is completely missing. So I'm not surprised, and people are looking at the refusal from the healthcare workers, and they're right in saying that if the healthcare workers are not getting vaccinated, then clearly it's a message that is being given forward. I've been speaking to the healthcare workers over the past 3-4 months, and was always talking to them about this. That what is your own institution doing in terms of getting you ready for vaccination? And they said, well, they just pass, we just get pamphlets or we get updates. But there is no consistent education and no consistent opportunity for people to raise their concerns and to ask questions. I think without that, it is going to be very difficult to overcome this vaccine hesitancy. And I feel very distressed about this fact that, we then blame the victim and we say, well, these people are illiterate and they are uneducated and they are this, that, and the other, and they don't listen. There is a way to make people listen, and there is a way to make people understand. There is enough research done over the past 30, 40 years. Countries that have eliminated the vaccine-dependent diseases, they showed very consistent policies that they followed up at the higher level, policies that were made and embedded within the local systems and in the socio-cultural practices of people.
Yeah, except we are trying to the roof while it is pouring heavily. So let's see how that works out. But thank you so much, Dr. Shapa Mirza. Thank you, Dr. Samia Altaf, for speaking with us. This is all from In Focus tonight. We shall see you tomorrow at the same time. Keep following our latest updates on social media at indus.news. Good night and goodbye.